everyone, it's Rena Jadov here with Dr. Neal Barnard, and we are answering the question which is raised in chapter 3 of his book. What is the revolution in type 1 diabetes? Will diet help type 1 if you've already been diagnosed? Dr. Neal, what's the verdict on that one?
Yeah, this is the most amazing thing. Type 1 diabetes means that the insulin-producing cells of the pancreas are gone. They're not there anymore. So if a person has type 1 diabetes for the rest of their life, they need a source of insulin. That means injections. You can change your diet as much as you want. You're still going to need some insulin injections. So should you change your diet? Absolutely. Here's why. If a person has type 1 diabetes, it's not the high blood sugar that's going to kill you. What's going to happen? For most people, what's going to happen, the damage, is damage to the blood vessels to the heart, to the eyes, to the kidneys, to the extremities. The blood vessels are attacked by the diabetes process. So I don't want any cholesterol in my diet. I don't want any animal fat in my diet. I want to protect those blood vessels. So if a person follows a healthy plant-based diet, or a vegan diet, keeps the oils low, the arteries are really protected. And so that heart attack hopefully isn't going to happen. This is a way of making the complications not occur. The other thing that it does is it tends to reduce insulin doses. And I'm never sure why this happens. But if a person might need, you name it, a certain number of units of insulin, before they change their diet, they need a whole lot less once they follow a healthy diet. So the answer is you still follow the same diet as for type 2. For type 1, you're still going to need some insulin, but you'll need less, and the complications are less likely to happen.
Oh, that's very, very encouraging. And can someone follow a diet to prevent type 1? So can the same diet actually help in prevention?
We don't know for sure, but we think so, and here's why. When you look into the blood of a person who was newly diagnosed with type 1 diabetes, you find something in the blood. Those are antibodies. Antibodies are proteins, little protein molecules that are like little torpedoes that are trying to destroy viruses or destroy bacteria. But in this case, those antibodies have destroyed the insulin-producing cells of the pancreas. Where do they come from? Antibodies are usually sparked by some protein that you ingested. What could that be? It could be a virus, but there's a lot of evidence that it could be cow's milk products. So our advice is that babies need milk. They need mom's milk. They need mother's milk, human breast milk, and that human babies should not be exposed to milk from a cow or any other animal. And there's a lot of evidence that when kids are breastfed, their risk of getting type 1 diabetes goes way, 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 way down. So step 1 in preventing type 1 diabetes is to breastfeed kids from day 1 and to not expose them to the antigens, which are in cow's milk. That's probably the most important thing. Stay tuned. There's more testing of this going on, but I think that's probably the most important strategy for prevention.
That sounds great. All right. Well, in our next video, we are going to talk about the next set of chapters in Dr. Neal Barnard's book, starting with the powerful new menu and the foods that you can eat to heal from diabetes. We'll see you on the next one.